computational different disciplines. So sociology is the first one, but we're going to hopefully do science and public policy. So to showcase all of the different ways computational social science is being done within disciplines. That's the goal here. And so the Center for Computational Social Science is really new. This is one of our first events, but I just want to flag another event, October 27th. We will be having a symposium on large language models and generative AI. So if you're wondering if you can use large language models in your own research, we will be having a workshop on how to implement them in Python and R. We will follow that with a discussion about how people are actually using them in their own research. So social simulations to measure biases and stereotypes in languages. And then we will have a discussion about the ethical and legal problems with it. So how do we deal with data from so many people who haven't given their consent to use their data? And then we'll have a big keynote discussion about whether democracy can survive generative AI. So all of it, which is the goal of the Center for Computational Social Science, is that it's not just one thing. We need tools, we need methods, we need research, we need legal and ethical considerations, and it affects society as well. So that's the goal, is to bring that all together. So look out for that October 27th. Practical and big questions, and we would love for faculty and grad students to come. And yes, we will be doing Python R as well, so practical stuff. Okay, so I will now turn it over to the actual introduction of the actual speaker. Thank you.
So, hi, it's a great pleasure to introduce today's guest speaker for our Distinguished Speaker Series, Dr. Zack Almquist. Dr. Almquist is an Associate Professor of Sociology, Adjunct Associate Professor of Statistics, and Senior Data Science Fellow at the eScience Institute at the University of Washington. He's also the training PI for the Center for Studies in Demography and Ecology. Professor Almquist's work is focused on developing and implementing mathematical, computational, and statistical methodologies for studying social networks, demography, education, homelessness, and environmental action and governance, and can be read in prestigious outlets like the Proceedings of the National Academy of Science, Journal of Computational and Graphical Statistics, Sociological Methods and Research, Sociological Methodology, among other journals. In addition, his work has been recognized by the American Sociological Association, where he won the Leo Goodman Award and the section on Mathematical Sociology's Outstanding Dissertation Award, as well as the National Science Foundation's Career Award and the Army Research Office Young Investigatory Program Award. In today's talk, he will walk us through three major projects he's currently working on, focusing on measuring how people experience homelessness in the Seattle area. Please join me in welcoming Dr. Zack Almquist.
I think I've got my own microphone. All right. Acknowledging that it's all being recorded. I'm really excited to be here. What a great way to kick off the fall here in beautiful Vancouver. It's nice to be a little farther north. I always find it beautiful up here. Today, I'm going to talk about big and small data for understanding demographics and health of people experiencing homelessness in King County. All right, so I like to get us all on the same page, kind of get an idea of where I'm going, right? It's not a novel. I'm not trying to surprise anyone. So first, I want to talk about how big the problem is, kind of some of my motivation, how I got here, a general overview of the projects. The big core of the talk is going to be around network sampling for enumeration. I'm going to do a big data discussion. I've got some work around databases and service records, kind of classic computational social science work. I'm going to talk about a sleep study I've been engaged in. I'm going to end with a nice quote from a focus group that I worked with, and then some final future directions. All right, so first, how big is the problem? So it's estimated in the United States in 2022 that there are more than 580,000 people experiencing homelessness on any given day, right? So just to give you a little bit of context, in King County, the estimate's around 13,000. Now, if you do a roll-up of just people who touch on the services of people experiencing homelessness, That's 40,000. That doesn't include the unsheltered people who don't touch services. Okay, but that's over a year. So at a single night, we have this 580,000 number, or about 25,000 in Washington alone. And this increase has been so explosive the last decade that many cities, counties, and even states have declared a state of emergency, the same thing they do when there's like a massive fire or an earthquake. So it's a huge problem in the number of people, just a humanitarian disaster. But it impacts on so many different levels with modern issues. One is interaction with the environment, right? Having people living outside all the time has a lot of potential consequences. You have people using open flames, fires happen, right? You have lots of garbage and other issues that just come about from living, right? And depressingly enough, we don't provide enough access to things like bathrooms and trash cans, right? So people are basically forced to just like live in it. Climate change is one of the biggest problems coming on in the next, year, 10 years, 100 years. And it's going to massively impact people experiencing homelessness. You think about in LA where people live in basically floodplains and they can get flash floods now. We have huge forest fires. People are out living in the woods. People are living outside breathing that smoke for weeks on end. You have just general public health issues, right? I tend to use this example. There's this hepatitis outbreak in San Diego. The solution is to get people washing their hands. So you have to have some way to drop out a bunch of hand washing stations and communicate how to find them. And then, of course, you have COVID-19, right? And like every social scientist, from now until who knows when, we have to think about the impacts of COVID-19 on our research and how we think about things and how it's changed problems. In this context, right, we've seen a big increase, of course, in the number of people who've died who are experiencing homelessness. An excess death account of at least 3% is estimated right now. We have the end of the national eviction moratorium in the United States happening. And there's a big expectation that once the courts start processing these, that we're going to see a lot more people end up on the streets. We have general issues around shelters and housing. During COVID, there was a big decrease in the number of shelters. You had these like 6-foot rules, which also seemed like probably wildly inadequate. But it meant that a lot more people were forced onto the street and outside. And just in general, in the US, there's been a massive growth in the unsheltered population. All right, so after that very fun, motivating context, right? But it really is just a big issue. It's one that's multifaceted. It's going to take a lot of different people to really tackle. It's systemic, it's problematic. All right, so where does my work fit in this like larger ecosystem? Right now, oh, that's a bummer. Sorry, one sec. That's a little better. Sorry about the annoying stuff on the side, but at least the slides aren't completely cut off. So I'm going to walk you through 4 big projects. The core of this presentation is going to be around my network sampling for enumeration, my trainings in social network analysis. One of the, I think, very cool tools that's come out of that field is the ability to create a effectively probability sample when you don't have a sampling frame. I'm going to talk about a big data. There are lots of service providers, lots of records, and you can think about how we can improve our knowledge and potentially help people working with historical data. One of the core problems, of course, with living outside is sleep. I'm going to talk about a sleep study and sort of how we're thinking about different interventions. And then last, I'm going to talk a little bit about focus groups and discussions around different methods for counting people experiencing homelessness. All right, so to really go over this process of using network methods to understand totals and proportions of people experiencing homelessness, I'm going to first talk to us about how do we count people experiencing homelessness in the United States, set up the basic framework, some issues, and then details. All right, so first, how do we count people experiencing homelessness in the United States? There is no set standard for every location, but most places do it in approximately the same way. It is the so-called point-in-time count. The idea is we have a geographic region. I'll talk a little bit more about what those geographic regions are. And they're asked by HUD, basically the US federal government, to enumerate all the people in shelters where they do just a shelter count through rosters, and all the people who are living unsheltered. And the way that they get the unsheltered count is they do a visual census. And that visual census, they get about, however many people in the area. So in King County, it's about 1,000 people. They get them all together and they spread out over the city and try to tabulate everyone they see. So first, a little bit about the geographies and the history of how this count came about. So we saw this number, right? 580,000 people are experiencing homelessness on a single night. Where does that number come from? Back in the late 90s and finally codified in the early 2000s, the federal government started doing this thing called continuum of care. It's a geographic and usually a nonprofit or state or county agency. And what happens is the federal government doesn't want to give money to all the different organizations in an area, right? In King County, there might be 1,000 organizations that engage in outreach. And so there's a single group called the Continuum of Care. In King County, this is the King County Regional Homelessness Authority. And they get all the federal money and they distribute it around. And among the requirements, they're required to maintain the HMIS, the Homeless Management Information System database, and they're required to do the biannual point-in-time count. And so these geographic entities range wildly from complete states to cities like Long Beach. They can be relatively complex. As you can imagine, right, the quality of the enumeration varies wildly by these different geographic regions. I really wish King County produced a map like Maricopa County. They do not. So I use this one because it's just publicly available, but this gives a good sense of what the point-in-time count looks like. So in King County, they go from 2 to 6 a.m., but this varies. Some places do it at midnight. Some people only do it at like 5 a.m. And what they do is they gather in a single place and they spread out and they tabulate everybody they see. So it's a literal attempted visual census on a single night. And so here you can see the historical data for King County. All right. So as you might imagine with such a process, there are some detractors, people who think that that is maybe not the highest quality estimate we could generate. One of those that's very recent is from Cy and Alcorn. They have a very nice short piece in the AJPH. And they propose a number of different solutions. but one of the things that they really call out, and that's really important for my work here and why I bring them up, is in 2021, basically nobody did the unsheltered count. Everybody got waivers to not have to do it. So there's an entire year of missing data. But one of the other interesting effects of this is HUD became very willing to give people waivers to try different methods afterwards. And that's sort of where I come in. So King County Regional Homelessness Authority in 2022 ran a respondent-driven sampling, a network sampling method for estimating the total number of people experiencing homelessness, the unsheltered population. Now, just a little bit of history of how this came about. I think this is pretty interesting. I think it's interesting because I was involved in it, but hopefully you will also find it interesting. So as I was saying, right, they were coming out of getting a waiver in 2021, didn't have to conduct the unsheltered count. They were very sure they were going to get a waiver again in 2022. And so they'd even made like a press release saying that they weren't going to do it. And then HUD came down really hard on all the continuum of cares and was like, you will do a count. Everybody's going to do a count. We don't have any information from the last, almost 2 years. However, King County Regional Homelessness Authority was really gearing up for a massive qualitative study. COVID had happened and they wanted a situation where they went out and talked to people. One, because they just were not convinced that they had a real grip on the needs assessment of people anymore. And two, because they wanted a real show that they cared. And by going out and talking to as many people as they could, they had this idea that, it's a real chance to engage with the community. So that is what they had earmarked most of the point in time count money for. And so they gathered together a number of people from a few different academic universities, and we got to pitch different ideas. And so I pitched this respondent-driven sampling idea. And one of the things that I did on the pitch was I was like, this also provides a really nice sampling frame for the qualitative study you guys wanted to run. So you can do both at the same time. And so they really liked that idea. And so they actually went out and did it in very short notice. They put the whole thing together in like 3 months. It was very impressive. All right, so I'm going to go back and get us all on the same page on the methods piece, and then we'll talk through the actual data collection. All right, so we have this very basic problem, right? We would ideally have a probability sample of our target population, and then we could estimate all of the things we want to know at a fairly high degree of precision. And we would do it the same way we do any other research, right? American Community Survey, all these big national surveys, right? This is a really nice framework to work from. However, all of those classic surveys, market research, they work from a sampling frame, right? If you're old enough, you remember the phone book. People used to randomly sample households by the phone book. Can't do that anymore, but it was something that people did at one time. Now, mostly people do address-based sampling. Obviously, for the unsheltered population without housing, they're probably not going to have an address for us to sample on. And so we need an alternative way. And so network sampling provides one of those alternatives. It allows you to sample without a sampling frame. What you need to do is recruit people from within the target network, and then you use referrals, and you work through the network until you have a large enough sample that is representative. At its simplest, there's this concept in mathematics and probability called a random walk, where you can generate a sample that's representative by conducting a process that's fairly simple. So you take a random node from the network, and then you sample along that node's edges, and you sample the next node in the network, and you do this repeatedly until you have a large enough sample. And this works really well. There's some really nice evidence looking at online networks that this generates a great sample. Respondent-driven sampling is sort of the offshoot of that same basic idea. So the key here, right, is we need to estimate two things. We need proportions, so like the number of African Americans in the population. We need totals, the total number of unsheltered people experiencing homelessness. And so to make this happen, we're going to have to leverage a little more information. Just doing it from the network-based sampling strategy will get you proportions, but it won't get you all the way there to totals. However, in this context, we do have a little bit more information, right? We have people who use the emergency shelter on the night in question. And we have that data at usually pretty high quality, especially in King County. And so I can leverage that to get an estimate of the total. So it turns out, right, the key idea here is fairly straightforward. The idea is we have two core populations, right? We have the people who slept in emergency shelters on the night and people who slept outside on the night, or even didn't sleep, but were outside. And we can break up the population into these two groups. We can use the respondent-driven sample to get the proportion estimate, and then we can do a little bit of algebra, and we can unwind this to get a total estimate of the unsheltered population. So just to give a demonstration of the effectiveness, I did a little simulation study built from some network data from a student at Stanford who conducted a network sample of people experiencing homelessness in Nashville, Tennessee. And we'll use this estimator that I just talked about. The nice thing being that the shelter count is, of course, provided publicly. So at least in this simple case, it works really well. The estimate of the unsheltered population from Dr. Anderson's data was 535. It does have a big confidence interval, but it solidly includes the point in time count, and it's not very far from it. And this is, not quite a respondent-driven sample data, but it gives a nice indication it's going to work. And then I also went through and checked a bunch of proportions, like the percent sheltered, unsheltered, gender, age. The one thing is Anderson's sample was a little old compared to the general population. And that's the only thing where we don't have good coverage. All right. So this is like a little preliminary work to suggest that this should, in fact, work pretty well. And then let's talk about the actual nitty-gritty of running this. So we have this idea, respondent-driven sampling. If you've never heard of it, the idea is like the network sampling that I talked about before, except with a couple key additions. One is that the data is all collected at hub sites. IRB really likes this because what it does is it allows people to voluntarily get involved or not, right? We're not going up and harassing anybody. There's a little bit of disadvantage to the not getting up and harassing people, but in general, I really like it. I like people to have the choice and the ability to volunteer to get involved. It allows us to do this network-based sampling, so we don't need a sampling frame, and it leverages peer recruitment. And the peer recruitment helps us get in and find people who would be otherwise really, really hard to find. It gives us a chance to really build up trust. It's a method that's been used very effectively by the CDC, NIH, and World Health. Its original development was primarily focused around estimating the number of people with AIDS or HIV. So there are a couple key innovations that I'll hit home over and over again in this talk. One is that For this counting problem, it really hasn't been used in people experiencing homelessness before. It has been used for understanding drug use behavior, which does, of course, include some people experiencing homelessness, but not such a direct application for these, governmental statistics. Leveraging the administrative data is my novel addition, and it has some really nice pieces. And then this addition of the qualitative study in this context is, I think, pretty novel. All right, so just to give you a visual of what we are doing, the idea here is we start with some seed nodes. In practice, we used outreach workers to help us find people to start with. These nodes in green. For cost reasons, we typically give people 3 coupons each survey, where the person, fills out the survey. We give them an incentive. They can get quite expensive quite fast, as you can imagine. So we recruit people via coupons. They come to the hubs, take the survey. We give them more coupons. They go out, bring more people, and you generate these tree-like structures. And then we can use statistical methods to get our unbiased estimates. So there's some lingo that people like to use, and by people, I mean I'm going to use. The first is the seed, right? These are the nodes that we start with. They can produce up to 3 people, right? Give them 3 coupons, that's wave 1. The next wave can have up to 9, that's wave 2. And we keep going until we decide that we have enough. All right, so we have a basic idea of the strategy, right? We're going to do this network-based sampling using the procedures in respondent-driven sampling. And we're going to use the administrative data, and we're going to make an estimate of the total unsheltered population. So first, I like to just do a little comparison with 2020 and 2022. So in 2020, people were outside like this, canvassing all over King County, about 1,000 people over about 6 hours. And then in 2022, we ran most of the hubs out of libraries or day use shelters, food banks, that sort of thing. So King County is a big area. You have downtown Seattle, that's a pretty large city, all the way to forest and national woods land. So in 2020, they counted from 2 to 6 a.m. There's a big report. And then for the demographics, they actually did it separately. It wasn't collected at the same time as the point in time count. It was collected about a month after. And this was in 2020, unfortunately, it was a very kind of ad hoc spatial sample. They went to shelters, day use sites, places where they knew people would congregate. But there's not a lot of evidence that they necessarily guaranteed that people were unsheltered. So it's a little unclear if the demographics are very high quality on that year. All right. So here are some of the core issues I like to bring up. One, I always find this a little entertaining. They mentioned rain as probably decreasing their count. It turns out that in January in Seattle, the likelihood of rain must be 100%, right? I mean, so calling out that it was raining when you do this is not a good sign. And they call out other things like visual obstructions, right? People are living in the woods, people are living under bridges and tunnels, people are hiding on buses. Turns out that when you have 1,000 people running around the county, it does not encourage people to pop up their head and be seen. In fact, it does largely the opposite. And then it's just a really complex environment to go over, right? You have urban, rural, and suburban communities, and you're trying to cover all of it. It's a huge organizational task. There's generally no quality control, as nobody knows really what a good visual census should look like the final results. And then, you know, in our context here, where they really wanted to do this qualitative study with people also, there isn't really a good way to talk to people while you're doing this process. The post-count survey, as I sort of suggested, in 2020 was a little rough. There are much better ways to do this that have more like classic spatial sampling properties over like tracts or blocks. These are census-defined units. But in this case, right, they had no real sampling frame. It's not clear how people were selected, and it's not clear that they didn't select a lot of people who were probably in the sheltered population. I should call out that there is one, there's a few, but there's one really big positive that can't be understated with the classic point in time visual census, which is that it's a gathering of all the people in the area who are worried about this problem. And so the loss of that gathering is really felt by the community when we didn't do this in 2022. So that is something that like just has to be kept in mind. All right, so comparing this to the respondent-driven sample that happened in 2022. So one of the nice things is, right, the demographic survey and the count survey are done at exactly the same time. You know it's on the right population. We generate things that are effectively a probability sample. We have some nice quality controls. It gives a very nice environment for running these qualitative interviews. It's a fairly like flexible protocol. And then this peer recruitment really brings in people from far and wide. It's really impressive. All right, so in 2022, we conducted the respondent-driven sampling for a month, from March 9th to April 6th. We had 9 hub locations based on information from previous pit counts, feedback from people with lived experience, and then other information from outreach workers. Altogether, each hub was staffed with at least one King County Regional Homelessness Authority administrator and 2 lived experience volunteer, well, 2 to 5, but a minimum of 2 lived experience volunteers. This was a really impressive group of people to have volunteer for this activity. And in fact, the Lived Experience Coalition did more than just get people to volunteer. They used some of their own funds to pay the people who went out to help with these surveys. So it was a huge act by them. And, you know, it really adds a nice set of people doing the interviews, right? Because they're really sympathetic to the problem. They're very trustworthy, very engaged group. Each of the hubs were operated for at least 2 weeks. They were each separately seated, an incentive of $25, and then respondents were recruited via coupons. Because they got set up very quickly and very fast, they ended up doing everything on pen and paper, old school way, which also for tracking the coupons is like pretty rough. I'm very impressed with how well they pulled this off. But so they had, these are what the coupons looked like, and then they collected all the data and spreadsheeted it. So altogether, they did 671 interviews. I want to point out each one of those interviews includes a 90-minute, you know, interview with the person recorded. So this is really pretty impressive, right? That they got this many with that high cost factor. And then I really like this quote from Owen. He talks about how, like, when he was engaged and then he was at the interview process, that he interviewed somebody who was out living in the woods, right? Somebody that you really would have a hard time finding in the classic point in time count. All right, so in 2022, a total of 671 interviews. The longest chain was 8. We got a pretty diverse set of people. And from that, we make our extrapolation that went out to HUD. So this is all the standard HUD required estimates, the unsheltered, and the various demographic breakdowns. One of the things I like to call out is that this also allows us to estimate things that you can't estimate from the classic HUD data. So we can estimate our hub location sizes. We can estimate how many people are living in cars or RVs. This is like very much a growing population, and is maybe one of the big challenges we're going to see going forward. All right, so kind of summarizing this first process, what worked well. I was really impressed with how well the qualitative interviews at the same time worked. Leveraging the shelter count gives us this ability to get a total count of the unsheltered. The LEC member interviews was a really nice, I think, piece. The fact they were able to deploy the whole thing in 3 months, and we were able to make all the estimates. Things that ended up being controversial, seed selection in principle shouldn't matter, but people always worry a lot about it. Recruitment planning in general, like just having more time. We're starting up already this year for the 2024 count with a lot more knowledge. Hub locations, there's a general sense that a lot of the minority communities, African American, Native American, are down South King County, and there's a feeling that they didn't have enough hubs and stuff locations set up correctly in South King County. And so there's also this question of like tying this process to the qualitative interviews itself. I can say for next year, they're not planning to do the qualitative interviews again for it. It is very expensive, and it makes the whole process harder, but is also like very cool that you could add it on pretty straightforwardly. All right, so huge thank you to, this is the leadership. There were obviously hundreds of people involved. So in 2023, there was no pit count done, right? HUD only requires them to do this every other year. So I got King County Regional Homelessness Authority to allow me to do an unofficial pit count using respondent-driven sampling. I got pooled together about 3 different grants to make this happen. And so in spring of 2023, I put together a team and we ran a respondent-driven sampling. So, again, thanking the leadership, there are a lot of other people. I recruited about 80 undergraduates to help make this happen. Even that, the staffing was like a little low. This is just with limited paid and only really a couple of people that I had, just a couple of graduate students. It requires huge staffing. All right, so we ended up doing a fairly similar set of hubs to 2022, though we added a couple in South King County as requested by King County Regional Homelessness Authority, given what they'd learned last time. And then we ran a very cool pilot study. So I have this colleague, Natalie Williams, if any of you know her, if not, it's okay, at the University of Washington, who wants to generate a longitudinal social science survey over all of the Puget Sound region. And she wants it to represent everyone. And so we're generating this big neighborhood-based sample. And one of the things that we want to include as we go on to try to find bigger funders is people experiencing homelessness, because they are part of the community and we want to make sure that they're well represented. And so we wanted a proof of concept that we could recruit sample and get them to complete this rather long battery of social science questions. So these are like economic questions, health questions, political questions, religious questions, immigration questions. It covers a huge spectrum. All right, so we did a lot of work to get this up. We built a custom app for tracking the coupons. This ended up working really well. We generate our coupons on the fly, we print them out, and we put a QR code and use an iPad to get all the information up. We tried to make this really lightweight, so we just had the network questions, HUD demographics, and a short needs assessment. The goal was for the survey to be like sub 10 minutes. Turns out in practice, this population really likes to talk, and I worked very hard with my interviewers to just saying, just let them. I felt it was a really important service and made it just, you know, I really wanted them to be respected and felt like we were treating them well. So the average survey is actually more like 30 minutes, and there are many that go on for like 90 minutes, 2 hours. Each site had a minimum of 3 people, a site manager, and 2 interviewers. We did kind of the bare minimum of training. We did a couple research training, what was getting the phrase, but basically it's a sensitivity training and safety training. In practice, some of the spots, there were just so many people that I had to move the teams up to like 10, 15 people to like keep things moving at enough pace. But I have to say there was never any violence. Everybody was really respectful. It went really well. It's just like, it was a great reminder that it's people out there. All right, so the Puget Sound data oversample is really cool. I'm excited for us to start digging into this data. We conducted it at 2 spots. The household survey, which is ongoing now, is a like cluster sample. And then we have this oversample of people experiencing homelessness in Seattle, and it's this huge social battery of questions. So just to give you a sense of how the respondent-driven sample worked in progress, we had this app. So we had people on iPads. They would scan the QR code, it would bring up, create 3 more QR codes that we would print out and give to the people, along with a physical Visa card that they could use anywhere. And then for each coupon that was returned, we would text them or email them a $5 gift card. And that worked really well. And so the process looks a little like this. We had these little printers. We would print out the QR codes, and then we would just stick them on our coupons. We give everybody 3 coupons, their incentive, and then when they came back, and when the coupons came back to us, we would email or text the $5 Visa gift card to them. Altogether, we surveyed more than 1,000 people, 237 in the Puget Sound data, Seattle oversample. You know, this is just to give you a sense of the heterogeneity of the locations. Some places generated a lot of people very fast and pulled from like all over the county. Some places where we thought there'd be people, it was really hard to get the network sample started. So overall, right, we have all of these different tree structures. Our longest chain was 19 waves. The like tracking process worked really well. I'm not saying we have like a ton at 19, but like we had a really nice distribution there. We can, of course, estimate out the degree distribution, and then we're just in the process of like cleaning up and analyzing the data. So these are all preliminary. I don't stand by any of these numbers, but this gives you a sense of some of the things we can pull out. So, you know, about 20% of the population was evicted from housing. People, you know, rate their health, as you might suspect, right? It's more towards the low end. We can look at where people were born, which, as you might suspect, right, overwhelmingly people are born in the state of Washington. People don't actually travel so far. But if you take out the people from Washington, you see a big West Coast bias, Texas. One of the things that I also am really excited to look at around these hypotheses is not just where you're born, but where you graduated high school. Because a lot of people, even though they weren't born in the state, did end up graduating high school in the state. And so they aren't traveling as far as you're thinking. All right, so future directions. We're going to do the 2024 PIT count as a respondent-driven sample. We're gearing up for that right now. I'm really excited to have these 3 waves of this going on, so I can hopefully really demonstrate where it works, where it doesn't, sort of best practices. All right, so now I want to shift us to something completely different: databases and service records. This is working with Amy Agopian, Paul Herbert, Asia Sutton, and Whitney Walker. I need to update this. Asia graduated in the spring and is postdocing at Stanford right now. She's fantastic. We work with the largest outreach service provider in Seattle, Reach Outreach. It grew out of the Evergreen Treatment Services, a public health group. They have structured and unstructured data going back like 15 years. Lots and lots of really interesting data. We're starting to work on like automated and classic hand coding of the unstructured text. The place where we really started those, they have records of where the tent encampments have been in Seattle for the last decade. So you can get a real sense of where people have been living outside over the city over time. And so we went through and we cleaned up the data and we geocoded everything. This was a lot of work and involved getting to understand different slang, like the knife's edge and stuff in the city. And so once we have these locations, we can start to look at the spatial distribution and its relationship to amenities and disamenities. We didn't want to publish the like location specifically. So we averaged things up to the city council level. You know, it's a distinct choice, but I think it's a very reasonable one because that's basically where policies are set in the city, and the policies really do differ, and it affects where people live and what sort of amenities they have access to. And so we're able to look at, you know, how close they are to grocery stores, bus stops, churches, needle exchanges. We're able to look at the changing size of the tent encampments over time. And we're able to look at the relationship to environmental data. So there are a lot of like Superfund sites, areas where the land is like basically probably pretty toxic. And it's fairly straightforward to show that that is one of the core areas people get pushed, especially people living in vehicles. We have another piece of this puzzle that's going on. We're working, there's a really great group at the University of Washington that models pollution. And they have really detailed pollution data all over the city of Seattle. So we're having them make really fine-grained estimates, basically bi-weekly over a full year for all the tent locations that we can compare against a random representative sample of people living in houses. So that's going to be like a really nice thing. The model, it turns out, though, takes like 6 weeks to run. So I'm still waiting on the regression model. You know, we did a bunch of preliminary checking, right? People are around traffic. People are close to hazardous waste, lead. Turns out we do not take care of our unsheltered population. All right, so there's a lot more to come. I think this is really rich work. You know, this is a nice space to bring this up, right? Because this is sort of where big data, data science, computational social science intersects with this sort of problem, right? There's lots of administrative data, and thinking about how we can leverage that data to improve what we know, I think can really make for better policy. And we did a little bit of that in the last study, right? We're really leveraging the shelter count and that data. All right, I've been working with King County Public Health. They do a lot of really neat, great stuff. One of the things they do is they have a mobile health clinic that goes all around so that people can get help. And that's a really important service, maybe one of the most important services. They do other kind of cool things. We have, as I said, this growing population of people living in vehicles. And so like people in RVs, they need to be able to dump their waste, right? And if they don't have somewhere to dump it, they just dump it wherever. And so they actually have a mobile collection where they connect up to the RVs and collect the waste, and it just goes around. One of the things that I'm really excited about kind of moving forward here is right now, all the mortality estimates for people experiencing homelessness in King County come from the coroner's office. That means that we only know if somebody is homeless and if they were expected to have been involved in a drug, suicide, crime of some sort. So that, of course, biases the data in a lot of ways, right? Because turns out people die for other reasons that aren't related to that. And so King County Public Health, because of this mobile van and a number of other activities they do, have a huge database of people who they know are experiencing homelessness over the year. And so they're connecting that database with the all mortality database at the state of Washington, and we'll be able to build really high quality estimates of the mortality for the population that will go beyond this coroner's office. One of the things too, we have this initial mortality data, right, is we can make an estimate of what areas in the city are much more, I don't know if dangerous is the right word, but like where people are dying. All right, so I want to move on to the sleep study. This is, I think, a really cool study. The way that we recruited people was pretty cool. I really liked this. So most of the community, we worked with just 4 communities to start with, a sanctioned tent community, 2 tiny house villages, and a really high-end shelter. And so the way that this works, I'm going to talk about the tent community for a second, is they're self-governed at the tent community. So we got an introduction to the leadership. We proposed what we were doing. They then had to vote on whether they wanted us to come out and offer the study. They voted to have us come and talk. We came and talked, and then they voted to let us run it there, and then they individually volunteered on whether they wanted to do it or not. And people we're really interested in it because, as you might imagine, right, when you're living outside, getting sleep really matters, and knowing sort of when and where you're getting high quality sleep is very much of interest to this population. And it should also be of interest to policymakers, right? Because these are all different treatments in effect, right? We are giving people different types of limited shelter, and some of which offer better sleep experiences and some of which offer less good sleep experiences. So knowing this is, I think, really, really worthwhile. So my colleague Horatio, who's a biologist, sleep specialist, pre-COVID, ran a comparison study between undergrads and 25-year-olds living in a men's shelter. And so I believe this is the undergrads, where their sleep is a little chaotic, but still fairly regular. And then you look over here, right, and you have some people who were like awake for like 3 days straight, right? So that's not healthy. I don't recommend that. So we ran it over the fall and the winter. We had 4 locations that volunteered. We had 31 participants. We ran for 4 weeks. We had watches, surveys, sleep diary, and biomarkers. It's a really diverse population, and I mean that in the sense that like people really come from all sorts of backgrounds. One of the things I like to point out, right, is people are oftentimes educated in this group, right? It is not something, it's something that hits basically everywhere, all over. So we have this really rich data. It's really complex data. We're still in the process of analyzing it. But you can really see the different sleep patterns in the different locations. I really thought the shelter was gonna be the worst offender. And then I reviewed what the shelter situation was like of the group that we were able to recruit. And this is maybe the nicest shelter I've ever heard of. So the black lines are movement. The white is where they're not moving. So the white is sleep, the black is activity. So each row is a person. So it's a bunch of people. So here is where the group is sleeping. Here's where they're very active, very active. Yeah. So the shelter looks like a college dorm situation, basically. They had a shared kitchen and bathroom, but they all had individual bedrooms, right? This is not the typical like church basement shelter that most people experience when they're in the shelter situation. And they did in fact sleep much, much better than everyone else. The tent community has to move every 90 days. And when we did the study, they were in a really, really noisy area. So like one of the things we have to think about is how to get good measures of noise and pollution in the area. Sometimes they're in really quiet areas. And so my hypothesis, right, is the quality of sleep and stuff probably really changes depending on whether you're in a quiet area or a really active area. The other is we also really need to recruit a more classic shelter to demonstrate in here, because the classic shelters, I don't know if you've ever been inside, are a little scary, right? You're with a bunch of people bunked up. It can be very scary, and people are known to get like hurt and so like and lose their stuff. So people don't typically sleep, I think, very well in them. As you might expect, right, hypertension and lots of other sort of biomarkers are pretty rough in this population. My colleague who specializes in this was just like, everybody is so low, I don't really know what to do with the data. So we're still thinking about this. Basically, yeah, basically people's health is not ideal. All right, so, you know, this is ongoing. hopefully we'll start getting out the first set of papers and stuff over the next year. But I'm hoping we can, really kind of get this idea on the map as one of the ways to think about improving the sort of treatments we do for people. All right, so I'm at 12, we're getting close, gunning for that hour. I have one last little study I want to talk about. I had a bunch of colleagues who I've actually really enjoyed working with, but they were really excited about the idea of using passive tracking to estimate the number of people. I'm gonna be honest, I was not excited about this. I think it's a terrible idea. Methodologically, they were interested in using cell phones, which is super complex, right? Just because in all the areas, right, there's lots of care providers in the area, so you have to figure out how to disambiguate that. People share phones, people share SIM cards, people swap phones. Actually making a count from cell phone data is really, really hard. But the other is just that ethically, it does not feel great, right? And so when we went and talked to people and over again, people did not like the idea of passive data collection, sometimes because they do illegal activity, sometimes just because it's like Big Brother looking over your shoulder, right? It is not, who wants to be passively collected, although admittingly, right, I'm probably have the weather app on my phone and it's passively collecting my location and selling it to a bunch of marketing firms. But ignoring my apparently lack of self-control, because I do like to know what the weather is. People were not excited about this, but when we talked about ways where they had the choice to be involved and a chance for them to be active, and of course, a chance to make a little bit of money, they were very, very excited about it, because the reality is, right, they care a lot about the problem. They want services, they want people to know they're there, but they want to have the choice to show that they're there. And so these survey sampling-based approaches really give them an opportunity for them to have some control. And I think that's a really big deal. So I like to end on that last quote, just remind people that, I think some of these classic methods improved with new modern technology and statistics have the ability to give people an opportunity to have their own voice in the process and for us to get like good quality data. So with that, I'm gonna finish analyzing the study that I ran in the spring. I want to compare with 2022. We're going to run this again in 2024. I'm hoping to expand the sleep study. I'm really interested in mobility and movement patterns, and we're hoping to use the big data to get a tackle at that and the mortality. And so with that, I want to thank you all for listening to me.
We have about 15 minutes for questions, and for the sake of people online, you just speaking.
Great. Thanks. Thanks for this really interesting stuff, a bunch of interesting studies. And I was really excited to see them. I guess one of the things that I had a little bit difficulty following in terms of trying to figure out how the networks that you're collecting are able to then generate counts and data on folks is whether or not there's any possibility you're going to be missing certain key populations, particularly through the hub framework, people coming to you. There's a lot of people with mobility issues, right? So how do you make sure those people don't get missed in your actual accounts that you're generating from networks? And I think if you can explain to me how those people don't get missed, that's going to help me understand exactly how you're generating these counts from the data. But again, thanks a lot.
Those are all really good questions. There are a couple pieces there. I can talk a little bit too. So in 2022, the care providers and the Lived Experience Coalition and a number of other groups provided extra services to get people to the various hub locations. It is expensive and continues to be like a big concern, right? So it is definitely a population where I expect we are undercounting, right? Anybody with any sort of mobility issue. And it is one of the costs in running this kind of hub type structure. There is discussion of one solution that I've been talking with colleagues is to run a spatial sample of short chains. So you have a mobile group, you run the basic respondent-driven sampling structure, but more localized for a small sort of targeted sample to try to fix those sorts of problems. Just make it a little easier for people as well as to stabilize the spatial dimension that is always like complex. Other issues, of course, right, with a network-based strategy is people aren't uniformly connected. There are people who are truly isolated. We certainly just, you know, except for when they wander in, because people do hear about things, but we're certainly underestimating, I think, the people who are truly, truly disconnected. That being said, at least in 2022, we did generate a larger estimate than the visual count. So while I'm sure we have all the problems you are bringing up, I think we still do a better job than what's done right now. I think one of the short, like basic problems with this is it's such a hard to reach population. We're never going to get better than a lower bound. And the question is like, how good of a lower bound can we get? And then like, you know, if I was a policymaker, I would take that number and I would probably, you know, add a fair bit to it for making resource allocation decisions. But I'm not in that unfortunate position. So I just try to remind people, right, that even if we're improving the number, I still expect it to be on the lower end.
Thanks for this
Yeah.
talk. I just, when I was an undergrad at University of Wisconsin-Madison, I organized the point in time count and I did it all like I got the money, I got the volunteers, they were undergrads. It was a mess, an undergrad doing that, it's a mess. And it was entered into the official records. So you were talking about quality control. Like, I think I did a good job, but I was an undergrad and I couldn't believe, like, now thinking back on it, I'm like, what on earth is going on? Like, how was that the official statistical count? But it was a great community building experience. But okay, more pointedly, so this, I love this because when people think about computational social science, they often think Twitter, Facebook, and there's this huge world out there. There's a lot of people, you and a lot of others working in administrative data, also like organizational data, like organizations produce a huge amount of data, governments produce a huge amount of data, and they need people to figure out how to do this and do it well. So I appreciate the care that you take. It's just a really, really good model. I'm saying this to the grad students, a really good model about how to apply computational skills, but in a very careful way that doesn't just kind of show all the fancy equations and claim that you're doing something really good. But the question I have is, I feel like this takes a lot of infrastructure. And so I'm wondering, like, what is the key infrastructure at the University of Washington that enables you to do this research? Because I also talked to Shelley Carell, who does this on the orgs level, right? She collects organizational data, and she says Stanford provides an enormous amount of infrastructure, and she couldn't do her work without it. So I'm just really curious, like, what are the key, and Washington has a great data science program. So what's going on at Washington that enables this, like, amazing research?
Washington's more of a hustle place, I think, than Stanford, which has a lot more resources. I have worked with some people at Stanford. Their infrastructure is amazing. This took me years and years, I should say. The like beginning pieces of these ideas and connections started when I was at the University of Minnesota. You know, I'd come off my PhD and I was thinking about where I wanted my next big project to be, one that I could do for a long time and work on a lot of different and motivating problems, right? And so I was thinking about disasters and mobility, and then my own lived experience, which if you've been anywhere in the US, you know, people experiencing homelessness are there. When I would take the train in the morning in Minneapolis, it was a mobile shelter. The entire train was filled with people experiencing homelessness. And I think it is going to be one of the major issues to tackle in the US. The housing crisis is not getting better. In fact, it's getting much, much worse. And so I started thinking about this. I started trying to understand the problem. So I went out with like navigation teams. I started reading, looking out, and thinking about what I had to like offer to the problem, right? And so I started thinking about these methods, and basically once I came to Washington, CSDE is an amazing resource for connecting people across campus and providing a certain amount of like small money pools. And so I got connected with other people who are interested. Maybe one of the most important is Amy Agopian, who I've done a lot of this work with, who has been working as an advocate for people experiencing homelessness in Seattle for 30 years. She knows everybody. And so her like name and experience gave me a chance to like talk to people who had positions to actually do things. That's how I got in the conversation with King County Regional Homelessness Authority. And then, you know, it's a pretty progressive city, Seattle. And so people really, really want to make things better. And so if you can persuade people that this seems like it might work, people are willing to try. And I really appreciated that. So I think, you know, you have a community that really wants to do something different, a university that's willing to help if you can get some funds, and like they have a bunch of health related funds. So a lot of the like local funding that came through this big Dean's initiative, the Population Health Initiative. And then I had the very good fortunate of getting a 5-year NSF career grant. And so combining all of those pieces together has sort of gotten me to this point, right? But that's, you know, I just described like 10 years worth of work.
It's Ralph Sultan here. I don't know if you can hear me. Can I ask a question?
Thank you for doing this and for presenting it to us. I have a respondent-driven sampling question, and I'm asking to be educated because I only know about respondent-driven sampling from like the jazz musician studies and like heck from back in the day, right? Because it was media. The last time I heard about it was a Salgonic paper in like PNAS, and I remember I didn't read it. I just remember like reading the abstract and being like, oh, some of these claims are overstated. And then so that's like, what happened with that, I guess is part of the question. And then the other thing that I never really understood, and I want to know better, is why is homophily not a problem? Like homophily in networks. I mean, so this is like, it's a classic problem with like snowball sampling and qualitative methods. So it's like, what is the formalization that makes homophily in networks not a problem here? And then ultimately where this question, so it's like, that Salgonic paper, what happened with that homophily, and ultimately where this goes, is this just kind of, a lot of times with these methodological fights, it's nitpicking without suggesting a better alternative.
I mean, so there's definitely that, right? So you've got, you always, when dealing with methods, have to differentiate between the practical and the methodological, like infighting. As far as the methods go, there's been a very steady amount of work, either on the empirical side, lots of public health studies. On the methodological side, there's a very great group out of UCLA and UMass that have improved the estimates using simulation tools. And then there's been a bunch of nice theoretical work showing basically that all the measurement error that you worry about doesn't actually influence the final estimator you're using that much. The key insight here is there's two really important pieces. One, your likelihood of ending up in the sample is much higher if you're really well connected. And so we need to decrease your probability basically in that. And the other one that's really important is there's been, actually, let me rephrase that. The other piece that's really important is we're doing mean tendencies. What we care about, right, is simple mean estimates. And so your law of large numbers, the sorts of things you learn in your stats class, they converge pretty quickly. Like the reality is if you have a reasonable guess of the probability of being sampled within the population and you reweight that to get your mean level estimate, it just generally works pretty well. So then you start heading up against the like two big things, which is sample size and like how much data do you need to throw away to guarantee that the process is sufficiently random. And so there's a bunch of like measures that people like. In this case, I'm not wildly worried about the seeds, I should say. They're really effectively randomly chosen. And while there is definitely measurable homophily in this network, we get wildly different groups. It's a hugely heterogeneous population. And so when I look over it and I have these like long waves and long chains, I can do lots of sensitivity tests. And, yeah, and then I actually have an additional advantage because I'm actually surveying over two networks. I'm surveying over the people who slept in shelters and the people who slept unsheltered. And so one of my like convergence diagnostics is how well I'm representing the sheltered population.
Zach, it's Ralph Sultan here. May I ask a question?
Thank
you hear me?
Just, I think maybe Laura's question and your response to Laura's question made me curious about the sustainability of what you're doing. And it wasn't particularly clear to me if you will be recruiting or training peer researchers in the long term and whether that will affect your ability to do this.
So I'm really interested in trying to make this like kind of turnkey. So we've been building software for the network part of the data collection to make it really useful. We're writing up a field guide and a research notebook. We're working on recording trainings. You know, I have money for another 4 years. I'm hoping that I can put together, you know, a nice solid location with a lot of resources for people. I have the team of people that I've been working with who are getting well trained. I have the people at King County, as long as, you know, their leadership doesn't have a big changeover, which is always a concern in an environment like this. And then I'm also working with the team that runs the point in time count in Los Angeles to run some of these experiments in some of their areas. Los Angeles is a very different space. You know, LA County is 10 million people. King County is 1 million. They break up the county into a bunch of different pieces. Each one of them has the same number of, has more people actually than the county, than King County. So it's a more challenging case, but they also, they're very progressive and they have the ability to try new things. So I'm working with them to hopefully integrate that in the future. Does that answer your question?